101. What is the role of estrogen in preventing osteoporosis? A. It promotes bone resorption. B. It stimulates bone formation. C. It reduces the absorption of calcium. D. It inhibits bone formation. Answer: B. It stimulates bone formation. Rationale: estrogen helps to regulate bone metabolism by stimulating osteoblast activity, thereby reducing bone resorption and promoting bone formation. 102. Which of the following lifestyle changes can help prevent osteoporosis? A. Avoiding all forms of exercise. B. Increasing caffeine intake. C. Engaging in weight-bearing exercises and a balanced diet. D. Drinking excessive alcohol. Answer: C. Engaging in weight-bearing exercises and a balanced diet. Rationale: weight-bearing exercises and a balanced diet rich in calcium and vitamin D help maintain bone health and prevent osteoporosis. 103. Which of the following is a modifiable risk factor for osteoporosis? A. Age. B. Family history. C. Physical inactivity. D. Gender. Answer: C. Physical inactivity. Rationale: physical inactivity is a modifiable risk factor, and increasing physical activity, particularly weight-bearing exercises, can help prevent bone loss and reduce the risk of osteoporosis. 104. What is the first-line pharmacological treatment for osteoporosis? A. Calcitonin. B. Bisphosphonates. C. Parathyroid hormone. D. Corticosteroids. Answer: B. Bisphosphonates. Rationale: bisphosphonates are the first-line treatment for osteoporosis because they inhibit bone resorption, helping to preserve bone density and reduce fracture risk. 105. What is the primary benefit of weight-bearing exercise in osteoporosis management? A. It increases bone resorption. B. It reduces the risk of fractures by improving balance and bone density. C. It lowers calcium levels in the blood. D. It decreases bone strength. Answer: B. It reduces the risk of fractures by improving balance and bone density. Rationale: weight-bearing exercises help increase bone strength and density while improving balance, which reduces the risk of falls and fractures in individuals with osteoporosis. 106. What is the role of vitamin D in bone health? A. It stimulates bone resorption. B. It enhances calcium absorption and promotes bone mineralization. C. It inhibits bone formation. D. It prevents calcium absorption. Answer: B. It enhances calcium absorption and promotes bone mineralization. Rationale: vitamin D is essential for calcium absorption in the intestines, and it promotes bone mineralization, which helps maintain bone density and strength. 107. Which of the following conditions can result from untreated osteoporosis? A. Liver failure. B. Bone fractures, particularly in the spine, hip, and wrist. C. Chronic fatigue syndrome. D. Dehydration. Answer: B. Bone fractures, particularly in the spine, hip, and wrist. Rationale: untreated osteoporosis leads to weakened bones, increasing the risk of fractures, especially in weight-bearing areas like the spine, hips, and wrists. 108. What is the role of bisphosphonates in osteoporosis treatment? A. To promote bone resorption. B. To inhibit bone resorption and increase bone density. C. To reduce the absorption of calcium in the intestines. D. To stimulate osteoblast activity. Answer: B. To inhibit bone resorption and increase bone density. Rationale: bisphosphonates inhibit osteoclast activity, reducing bone resorption and allowing the bone to maintain or increase its density, reducing the risk of fractures. 109. Which of the following is a common complication of osteoporosis in the elderly? A. Stroke. B. Spinal fractures leading to kyphosis. C. High blood pressure. D. Diabetes. Answer: B. Spinal fractures leading to kyphosis. Rationale: spinal fractures are a common complication of osteoporosis in the elderly and can lead to kyphosis, curvature of the spine, which can cause pain and reduce mobility. 110. What is the function of osteoclasts in bone metabolism? A. To build bone tissue. B. To break down bone tissue. C. To increase calcium absorption. D. To secrete collagen. Answer. B. To break down bone tissue. Rationale. Osteoclasts are responsible for resorbing, breaking down bone tissue, a process that is essential for bone remodeling and calcium regulation. 111. Which of the following is a non-pharmacological intervention for managing osteoporosis? A. Hormone replacement therapy. B. Bisphosphonates. C. Weight-bearing exercises. D. Calcitonin. Answer. C. Weight-bearing exercises. Rationale. Weight-bearing exercises, such as walking and strength training, help improve bone density and strength, reducing the risk of fractures in individuals with osteoporosis. 112. Which of the following is a common risk factor for developing osteoporosis? A. High calcium intake. B. Physical activity. C. Low body weight. D. Adequate vitamin D levels. Answer. C. Low body weight. Rationale. Low body weight is a significant risk factor for osteoporosis because individuals with less bone mass are more likely to develop bone loss. 113. Which of the following is the most important factor in preventing osteoporosis-related fractures? A. Adequate vitamin D intake. B. High calcium diet. C. Regular physical activity. D. Medication adherence. Answer. C. Regular physical activity. Rationale. Regular physical activity, especially weight-bearing exercises, helps prevent bone loss, increase bone density, and improve balance, reducing the risk of fractures. 114. What is the effect of smoking on bone health? A. It improves bone strength. B. It decreases bone resorption. C. It inhibits calcium absorption and reduces bone formation. D. It increases bone density. Answer. C. It inhibits calcium absorption and reduces bone formation. Rationale. Smoking has a negative effect on bone health by inhibiting calcium absorption and reducing bone formation, increasing the risk of osteoporosis and fractures. 115. Which of the following is true about the relationship between aging and osteoporosis? A. Aging leads to an increase in bone density. B. Aging slows down bone remodeling. C. Aging decreases the risk of fractures. D. Aging stimulates osteoblast activity. Answer. B. Aging slows down bone remodeling. Rationale. As people age, the process of bone remodeling slows down, leading to a decrease in bone density and an increased risk of osteoporosis and fractures. 116. What is the primary concern with untreated osteoporosis? A. Increased bone density. B. Increased fracture risk. C. Decreased calcium absorption. D. Increased muscle mass. Answer. B. Increased fracture risk. Rationale. Untreated osteoporosis leads to weaker bones and an increased risk of fractures, particularly in the spine, hips, and wrists. 117. Which of the following is the best source of dietary calcium? A. Red meat. B. Dairy products. C. Citrus fruits. D. Whole grains. Answer. B. Dairy products. Rationale. Dairy products like milk, cheese, and yogurt are excellent sources of calcium, which is essential for maintaining bone health. 118. How does menopause affect the risk of osteoporosis? A. Menopause decreases the risk of osteoporosis. B. Menopause increases the risk of osteoporosis due to lower estrogen levels. C. Menopause has no effect on bone health. D. Menopause leads to an increase in calcium absorption. Answer. B. Menopause increases the risk of osteoporosis due to lower estrogen levels. Rationale. The decrease in estrogen production during menopause accelerates bone loss, increasing the risk of osteoporosis in women. 119. What is the primary function of osteoblasts in bone metabolism? A. To break down bone tissue. B. To build new bone tissue. C. To reduce calcium absorption. D. To promote bone resorption. Answer. B. To build new bone tissue. Rationale. Osteoblasts are responsible for synthesizing and building new bone tissue, playing a key role in bone formation and remodeling. 120. What is the most common fracture site in individuals with osteoporosis? A. Spine. B. Wrist. C. Hip. D. Forearm. Answer: A. Spine. Rationale: the spine is one of the most common sites for fractures in individuals with osteoporosis due to weakened vertebrae and increased fracture risk. 121. What is the most common symptom of osteoarthritis? A. Sudden loss of balance. B. Joint pain and stiffness. C. Shortness of breath. D. Swelling of the lymph nodes. Answer: B. Joint pain and stiffness. Rationale: osteoarthritis primarily causes joint pain, stiffness, and reduced flexibility, which worsen with activity or weather changes. 122. What is a key characteristic of rheumatoid arthritis? A. It only affects the elderly. B. It is caused by excessive exercise. C. It involves inflammation of the joints. D. It only affects weight-bearing joints. Answer: C. It involves inflammation of the joints. Rationale: rheumatoid arthritis is an autoimmune disease that causes inflammation in the joints, often leading to pain, stiffness, and swelling. 123. Which of the following is a common treatment for osteoarthritis? A. Corticosteroid injections. B. Insulin therapy. C. Chemotherapy. D. Antidepressants. Answer: A. Corticosteroid injections. Rationale: corticosteroid injections are often used to reduce inflammation and pain in the joints affected by osteoarthritis. 124. What is a hallmark sign of rheumatoid arthritis? A. Sharp, localized joint pain. B. Morning stiffness lasting more than an hour. C. Numbness and tingling in the limbs. D. Pain that worsens with exercise. Answer: B. Morning stiffness lasting more than an hour. Rationale: one of the classic signs of rheumatoid arthritis is prolonged morning stiffness, often lasting more than an hour. 125. What is the function of synovial fluid in joints? A. To protect bones from damage. B. To help transport nutrients to muscles. C. To reduce friction and cushion the joints. D. To produce red blood cells. Answer: C. To reduce friction and cushion the joints. Rationale: synovial fluid acts as a lubricant to reduce friction and cushion the joints, allowing smooth and pain-free movement. 126. Which of the following is a risk factor for developing osteoarthritis? A. Being overweight or obese. B. Regular physical activity. C. High calcium intake. D. Drinking water frequently. Answer: A. Being overweight or obese. Rationale: obesity increases the strain on weight-bearing joints, which can lead to the development of osteoarthritis over time. 127. Which of the following is not a typical symptom of rheumatoid arthritis? A. Joint swelling. B. Decreased joint range of motion. C. Loss of appetite. D. Skin rashes. Answer: D. Skin rashes. Rationale: skin rashes are not a typical symptom of rheumatoid arthritis, although other symptoms like joint swelling, stiffness, and pain are common. 128. Which of the following joint areas is most commonly affected by osteoarthritis? A. Neck. B. Knees. C. Elbows. D. Shoulders. Answer: B. Knees. Rationale: the knees are among the most commonly affected joints in osteoarthritis, particularly in older adults. 129. Which type of arthritis is considered an autoimmune disorder? A. Osteoarthritis. B. Gout. C. Rheumatoid arthritis. D. Bursitis. Answer: C. Rheumatoid arthritis. Rationale: rheumatoid arthritis is an autoimmune disorder in which the immune system attacks the joints, leading to inflammation and damage. 130. What is the primary goal of osteoarthritis treatment? A. To cure the disease. B. To manage pain and improve joint function. C. To reduce blood pressure. D. To eliminate swelling. Answer: B. To manage pain and improve joint function. Rationale: the primary goal of osteoarthritis treatment is to reduce pain and improve joint function, allowing individuals to maintain mobility. 131. What is the most common cause of gout? A. Excessive consumption of protein-rich foods. B. Increased levels of uric acid in the blood. C. Physical inactivity. D. Lack of vitamin D. Answer: B. Increased levels of uric acid in the blood. Rationale: gout is caused by elevated uric acid levels in the blood, which form crystals in the joints and lead to intense pain and inflammation. 132. Which of the following is a typical symptom of gout? A. Sudden, severe joint pain, especially in the big toe. B. Chronic muscle pain. C. Loss of hair. D. Swelling in the neck area. Answer: A. Sudden, severe joint pain, especially in the big toe. Rationale: gout typically causes sudden and intense pain in the affected joint, most commonly the big toe. 133. What is the primary treatment for acute gout attacks? A. Antibiotics. B. Antidepressants. C. Nonsteroidal anti-inflammatory drugs, NSAIDs. D. Insulin injections. Answer: C. Nonsteroidal anti-inflammatory drugs, NSAIDs. Rationale: NSAIDs are commonly used to reduce pain and inflammation during acute gout attacks. 134. Which of the following foods should be avoided in individuals with gout? A. Low-fat dairy products. B. Red meat and organ meats. C. Leafy green vegetables. D. Whole grains. Answer: B. Red meat and organ meats. Rationale: foods rich in purines like red meat and organ meats should be limited in individuals with gout as they increase uric acid levels. 135. What is a common complication of untreated gout? A. Kidney stones. B. Spinal fractures. C. Lung disease. D. Diabetes. Answer: A. Kidney stones. Rationale: untreated gout can lead to the formation of uric acid crystals in the kidneys, which can cause kidney stones. 136. Which of the following is a key feature of systemic lupus erythematosus, SLE? A. Joint inflammation and pain. B. Sudden weight gain. C. Rapid bone loss. D. Increased appetite. Answer: A. Joint inflammation and pain. Rationale: systemic lupus erythematosus is characterized by inflammation in various parts of the body, including the joints, leading to pain and swelling. 137. What is the primary cause of osteoarthritis? A. Poor posture. B. Joint injury or wear and tear. C. Genetic factors. D. Poor circulation. Answer: B. Joint injury or wear and tear. Rationale: osteoarthritis is primarily caused by the wear and tear of cartilage in the joints, which results in pain and stiffness. 138. What type of doctor typically diagnoses and treats arthritis? A. Neurologist. B. Rheumatologist. C. Cardiologist. D. Dermatologist. Answer: B. Rheumatologist. Rationale: rheumatologists specialize in the diagnosis and treatment of arthritis and other diseases affecting the joints and connective tissues. 139. What is a common sign of rheumatoid arthritis in the hands? A. Bone fractures. B. Joint deformities and nodules. C. Excessive muscle growth. D. Dry skin. Answer: B. Joint deformities and nodules. Rationale: in rheumatoid arthritis, joints, particularly in the hands, may become deformed or develop nodules due to chronic inflammation. 140. What is the most common treatment for rheumatoid arthritis? A. Physical therapy. B. Antidepressants. C. Disease-modifying antirheumatic drugs, DMARDs. D. Insulin therapy. Answer: C. Disease-modifying antirheumatic drugs, DMARDs. Rationale: DMARDs are the primary treatment for rheumatoid arthritis as they help slow the progression of the disease and reduce inflammation. 141. Which of the following is a key diagnostic test for rheumatoid arthritis? A. Blood test for rheumatoid factor. B. Chest X-ray. C. Skin biopsy. D. Urine culture. Answer: A. Blood test for rheumatoid factor. Rationale: a blood test for rheumatoid factor is commonly used to diagnose rheumatoid arthritis, although not all individuals with the condition test positive. 142. Which of the following treatments is typically used for gout prevention? A. Non-steroidal anti-inflammatory drugs, NSAIDs. B. Colchicine. C. Allopurinol. D. Insulin injections. Answer: C. Allopurinol. Rationale: allopurinol is a medication used to reduce uric acid levels in the blood and prevent gout attacks. 143. Which of the following is not a treatment option for osteoarthritis? A. Joint replacement surgery. B. Pain medications. C. Anti-inflammatory drugs. D. Antidepressants. Answer: D. Antidepressants. Rationale: antidepressants are not typically used to treat osteoarthritis. Treatment usually involves pain management, anti-inflammatory drugs, and possibly joint replacement surgery. 144. What is the function of a joint's cartilage? A. To store calcium. B. To absorb shock and reduce friction. C. To generate blood cells. D. To supply oxygen to bones. Answer: B. To absorb shock and reduce friction. Rationale: cartilage provides cushioning for joints, absorbing shock and reducing friction during movement. 145. Which of the following is a typical symptom of ankylosing spondylitis? A. Skin rashes. B. Pain and stiffness in the lower back. C. Sudden weight loss. D. Chronic headaches. Answer: B. Pain and stiffness in the lower back. Rationale: ankylosing spondylitis typically causes pain and stiffness in the lower back and can lead to fusion of the spine over time. 146. What is the primary goal of treatment for rheumatoid arthritis? A. To cure the disease. B. To relieve symptoms and prevent joint damage. C. To lose weight. D. To increase blood flow. Answer: B. To relieve symptoms and prevent joint damage. Rationale: the goal of rheumatoid arthritis treatment is to control symptoms and prevent long-term damage to the joints. 147. What is the primary role of the immune system in rheumatoid arthritis? A. To promote tissue healing. B. To fight infections. C. To attack healthy joint tissues. D. To prevent blood clots. Answer: C. To attack healthy joint tissues. Rationale: in rheumatoid arthritis, the immune system mistakenly attacks the synovial tissues of the joints, leading to inflammation and joint damage. 148. Which of the following is a common symptom of osteoarthritis? A. Sudden weight gain. B. Joint swelling and heat. C. Gradual joint pain and stiffness. D. Unexplained rashes. Answer: C. Gradual joint pain and stiffness. Rationale: osteoarthritis often presents as gradual joint pain and stiffness, especially after activity or prolonged periods of inactivity. 149. Which of the following can help manage osteoarthritis symptoms? A. Excessive bed rest. B. Physical exercise and weight management. C. Complete elimination of exercise. D. Consuming large amounts of alcohol. Answer: B. Physical exercise and weight management. Rationale: regular exercise and maintaining a healthy weight can help manage osteoarthritis symptoms by reducing joint stress and improving mobility. 150. What is the role of physical therapy in the treatment of rheumatoid arthritis? A. To cure the disease. B. To improve joint flexibility and strength. C. To replace damaged joints. D. To stop the immune system's attack. Answer: B. To improve joint flexibility and strength. Rationale: physical therapy can help improve joint function, flexibility, and strength, which helps reduce pain and prevent further damage in rheumatoid arthritis.